So we'll just read it.
Okay.
Okay.
So the last question was, what was the difference between the ways Lucy communicated with the physician on the telephone with Francine and with Jane? Oh my God, I should have waited to say mine until this question.
So I thought that Lucy communicated with the physician using SBAR, like situation, background, assessment, and recommendation.
Yeah, very professional.
Yeah.
Very-
She used like in
point,
her
yeah.
assertive technique where she acknowledged, everybody else's feelings. She said what she needed to get done and how like the things she needed, but she also acknowledged, how they were feeling, their own opinions and ideas, and it worked really well. I mean, it was the most effective way that she communicated through the entire video.
Yeah, she was doing her job. Like, she was professional. She was doing her job.
Yes, that was Nico talking, by the way, because
Sorry, my video is not working anymore.
yes. So go on, Ruben. What were you saying?
I was just gonna say that it was just very straight to the point. It wasn't like, so how's your day doing? No, it was like, I need this, blah, blah, blah. And then it was just done. Like, that's work. It wasn't
Yep.
like,
Which was the SBAR method, as was
Sorry,
said.
that was my niece in the background.
She was, discussing the situation, giving background information on the patient, assessment on the patient, and she even asked recommendation
Mm-hmm.
to the doctor for the chest x-ray.
Yes.
Right. And she communicated in like a really respectful way, both like in her mannerism and her verbal communication. And I think that's what made it work so well as well.
Yeah, and that's how it should be from nurse to doctor, nurse to provider.
Right.
You have to be informed, use the SBAR method to improve communication of the client information.
Yeah.
Which is
That's
why
very formal.
SBAR is always recommended.
Well, like I had said earlier, I definitely feel like her communication with Jane was like more assertive, like, okay, well, I'm not gonna do what you're saying because that's not right. I'm gonna do this instead if I do anything. Versus when she was talking to Francine, she was more like, oh, well, like, I'm sorry, like, I have to do something, but I promise, so I'll do it. Like, you know what I mean?
Right. She was a little more passive, where she kind of just like was like, oh, my feelings aren't as important as yours. Like, I said I would do this, and so I'll do it, even though I'm overwhelmed. And she kind of just didn't acknowledge her own feelings at that point. And I felt like she kind of just got bulldozed and she just let it happen.
Yeah.
And that was to Francine, right?
That was the Francine. Yeah.
Yeah. I feel like too, Lucy was a little passive. Like,
He was passive.
she was like, well, I
submissive.
have all this stuff to do, but not like that. But, essentially saying like, I have all this stuff to do. Like, I can't do it right now. But then Francine was more aggressive and dismissive to what Lucy had to say. She's like, oh, well, you promised me, you remember? And she did it in front of Jane too, which creates conflict in the work environment.
Yeah.
You know,
So I
it's
guess
better-
she kind of started off like assertive, like, hey, and I can't do this, this is how I'm feeling, and then kind of turned into a more passive, the more aggressive Francine got with her communication.
Yeah, it was very submissive.
Yeah.
That's the word I was looking for, submissive. I was like making, I was trying to say submissive. Thank you.
So that seems to be Jane's trait, though, because if you notice, she was, dismissive, passive, was speaking with Francine, and then she became assertive, and then back to passive, and then when she talked to Jane, it was assertive, passive, aggressive. That's just who Jane is.
Jane or Lucy?
I'm sorry, Lucy.
Okay. Yeah, I feel like Lucy was more of the professional one out of the group of three.
Yeah.
She at least tried to.
She's professional to a point because if we're going to use the term, she also has to be professional even if they are her friends outside of work. She needs to learn how to separate that work friend relationship. You know what I mean?
I am very much a Lucy communicator, and I have a very hard time when somebody is assertive to me. So I'm not going to defend Lucy. I feel like she would have responded how I would have. I would have been a submissive. I would have been like excuse after excuse, like why I can't help you, trying to make it sound better on my end because I'm timid. So like, that's not an effective way to communicate with a coworker. She should have been like, no, this is why, let's problem solve. I would have been the way Lucy reacted. That's why I'm hard on her. Like, I feel like her way of reacting to Francine was inappropriate.
I agree
Yeah, I
with
feel
you
like
100%.
That's
I
just
feel like
that's
you
how
have
I
to
would
know.
react.
Yeah, you have to know your own needs and you can't put those aside, because at that point she might end up putting one of her patients at risk because she decided that she was going to let somebody else make decisions for her.
Yeah. Excuses like weren't necessary though. Just like quick to the point. Like, this is what I need. This is why I can't do it. Let's fix it from there. Not like I have a million things to do. This is why I can't do it. I mean, like, that's just like everyone has a million things to do. Like, it's just not effective.
And then ultimately she agreed to do it and then complained to someone else, which
Yeah.
involved a third party that had nothing
Yeah.
to do with it, which is now going to create a hostile work environment. So it's just one bad decision after the
Should have
other.
just been.
Emily, can't hear you, love.
Yeah, I can't hear you.
Just
Emily,
mute
your
and
face
unmute.
is frozen.
Try and mute and unmute.
Good?
Yeah.
Yeah.
Okay. I was saying, but I feel like Jane was the one that started it because Lucy was just chilling there
Jane's problem.
eating, and then Jane was like, "Girl, I cannot believe that happened." Essentially bringing it back up. Like
But yeah,
Lucy
that
could've-
was the app. She was more reactive to what the information she was being told. You know what I mean?
Yeah,
So
yeah.
it's like, so you're complaining to another coworker who has nothing to do with the situation, when in fact you and Francine should have been communicating better instead of letting Francine, run away with the decisions.
But I don't
You
really
could've-
think Lucy brought it up though. Jane was intentionally bringing it up to start
Yeah,
a
but
problem.
I feel like she was still like, she was more passive towards Jane. I think Jane didn't have any like bad intentions. I think she genuinely thought like she was going to help, like giving her
Right.
like good info, like advice. But and
Mm-hmm.
Lucy was a little bit more passive towards like Jane. Like, where was that energy with Francine? Like,
Yeah.
Or where was that volunteer when you could have helped us all? How about that?
literally.
Yeah, I feel like everybody in that area was at fault too.
Yeah, I don't think there was any like
Think
right
that,
in
like,
anything.
that Jane and Lucy may have like they may have a better relationship at work than Francine and Lucy do, because she was brave around she was brave around Jane, but not Francine, which is like, again, this is how I am very like shy, timid, submissive to people that like push me. So she might have a better relationship with Jane than she does at Francine. Because like,
But
if I
if
know
you-
you, I would tell you off.
If you don't have a great relationship with a coworker, would you offer to cover her break?
But no, like I'm saying, like Jane and Lucy have a better relationship. Francine is like not how I feel.
I see, I definitely see where you're coming from, but at the same time, if they did have a better relationship, I think she would have like taken her advice rather than. Do you
I don't
what
know.
mean?
She might feel brave enough to say how she really feels to her, though. Like, I would tell my best friend or my friend at work, like, no, I'm not going to do that. But like, I wouldn't tell the person that was like coming at me. I wouldn't tell them.
I would have been like, why didn't you say something?
I'm so timid.
Yeah, but like I feel like that's something we all need to grow on too. We all have to have good
100%.
communication skills.
Mhm.
And I feel like that's what this ETI module hits on. Like, there's times where we need to speak up. Because like I said, if she would like, she's covering her shift essentially 30 minutes, anything can go wrong with her patient that was, needed the chest x-ray. And like, you don't know how Francine left her patients. Maybe one of them starts coding and then one of hers starts coding, then what?
Yeah.
And I feel like Jane is not really helping either. I feel like she'd be like, "Oh, girl, you would not believe what happened," The insinuator of it all.
Jane is the
Stirring the
problem.
pot, stirring the pot. Yes, she is.
Her. She is the
Being
problem.
manipulative, which is the passive aggressive behavior.
Yep.
Because
Yeah, because I feel like she could have also like, if you're hearing that like what's going on. You could have like Jane herself could have gone to like the charge nurse and like explained to her, hey, this is going on. I don't know if she's gonna need help. I don't know like what
Yeah.
I should do. Like if she, yeah.
Or even Jane could have gone to Lucy and been like, hey, I can take over Francine's stuff while you're working, while you go get the x-ray done. Like stuff like that. It's all about communication and team. Nursing is a very team, like you have to be good, have good teamwork
Yes.
in order for
Good
everything to
relationships.
function.
Yeah.
Yes.
Good communication.
Yes, that too, because you rely on your CNAs, you rely on other nurses. It's not all, let me focus on myself. It's more about how can we all come together that deliver the best possible patient care.
Mhm.
And then for this example, it just blew up on everybody.
Everyone fell short.
Yes, there was no
that-
responsibility at all.
In that 2 minutes and 41 seconds, there was a lot of drama.
Literally. I know we've been talking for like, and it was only a 2-minute video. That's crazy how much we like got from it.
Yeah, you
There's a
really
lot
can
of content there. Yeah.
break down a situation. And so do we all agree
Right.
that Lucy and Francine were both passive aggressive towards each other?
One was passive aggressive. I think the
And
other
then
one was assertive.
I think one was more passive and then one was more aggressive than
Yeah.
anything.
Okay.
Yeah.
Very
so-
assertive. Yes, definitely assertive.
and then the conversation between Lucy and Jane? Is it Jane? Yeah, Jane.
Was
We would-
inflammatory.
We would agree that Jane was passive aggressive.
Yeah, Jane was
Okay.
I mean, I felt like, yeah, she was being passive aggressive, but I think in the situation she was trying to be assertive, where she was trying to understand her feelings. Like, I think that's why she brought it up. And she's like, oh, well, maybe she needs to talk about this. Maybe she's feeling bulldozed, but I think it just came out in the wrong way.
Mhm. And then
Sorry, I got
Lucy-
lost this last minute. Everybody was getting a little loud in my house. I didn't pay attention to what was going
Oh,
on.
we're just talking about how the conversation between Lucy and Jane. Like
Okay.
our final thoughts of the whole situation.
So Jane came off passive aggressive when talking to Lucy.
Yes. And then Nico was saying that maybe she was trying to be assertive, but it just came out the wrong way.
Mhm.
Like she was coming from a good place, like saying, hey, we should do something up. You should do something about this, because like she said, it wasn't the first time this happened,
Mhm.
but she didn't take it by protocol as it would be on the chain of commands.
Yeah, it came off kind of gossipy instead
Yeah.
of empathetic.
And then
Um,
Lucy responded to Jane in an assertive manner.
Yes, because assertive communication is effective but difficult to master, and it combines honesty, active listening, and providing feedback, which I think she hit all those points.
And uses
Yeah.
I statements.
When giving Jane like, hey, I'm not gonna go straight to the manager, I'm gonna go to our charge nurse. That's if she decides, because remember she said, if I want to, I'll go speak to the charge nurse to get everything situated.
So I feel like in summary, like Jane would like to hit the first point. Jane kind of suggested to Lucy to use like the face-to-face channel because she wanted her to go talk to the higher ups before talking to the charge nurse, which isn't the chain of command. And then I think she was using that technique of passive aggressive and assertive like mixed together because she was acknowledging her feelings, but she was also being kind of gossipy. And then the channel that Lucy planned to use was also face-to-face to the charge nurse, in which they, that could end up being a written channel later for somebody else.
Mhm.
And then I feel like we hit the last point a lot. So I don't know if we need to summarize that one.
One thing I wanted to say, I didn't have a chance because you guys kept talking, but I just wanted to let you guys talk. Was Lucy, at the end of the day, she was just being nice. Like she was trying to make everyone happy. But like I kind of just realized that that's pretty dangerous because she can't make everyone happy. And not only is she sacrificing her own like happiness, she's also like risking her patients with other patients just to make everyone happy. So she is being nice, but it's a little dangerous.
Yeah,
Very
because
non-confident.
Yeah, because at the end of the day, do you guys honestly think that she's gonna like say something to the charge nurse?
No,
probably not. And then
Yeah.
it increases
wouldn't.
her chances of getting burnt out, which we all know that is very dangerous and very common in the healthcare field. So I think that meeting that they had with that video, they would have all learned about passive aggressiveness, assertive communication. And anybody want to add anything else?
I'm good.
Good? Okay.
Yep.
Stop recording.